Hi, my dog lovers. Hi, good afternoon. It is Thursday and it is Facebook Live time. I'm starting to love Thursdays, even though it may seem to be a little twisted because every week on Tuesday, so Thursday, I have to get up, walk packs really quickly, and then I start hammering down my little talk. And this time I prepared talk on ear care because it's been such a difficult, challenging problem for so many of you. And we get many questions about ear problems. And I also know that they're often treated quite differently than what I would do. When I went through vet school, obviously I learned a certain cookbook approach to ears. But then as I went through my practical experience, I saw that what I learned didn't really work most of the time. So I developed my own plan, and today I'd like to take you through the steps of treating ear infections and reducing the amount of drugs and invasive treatments. And I hope that it'll help you to keep your dog healthy and make the right decisions, because it's not only about you knowing how to approach the problem. Sometimes you will need a vet and you will need to make a decision what to do and what not to do. And I'm hoping that this will be a really important information for you, and useful information mainly. So what I'd like to do today is I'm going to kind of share screen here and there, and then I'll also be just talking. We will have about an hour together. I will also have enough time for questions. So I'm hoping that you'll be asking some questions. And where do I start? Oh, there's so much to share and so much to do. It's kind of overwhelming to a point, but I think that we'll start with a story. When I came to Canada, it took me about 4 years to learn English and get my veterinary license again. And in the process, I worked as a technician. And then when I got my license, I started working in Whistler, BC, which is a very well-known ski resort. And I worked in a mixed practice, and part of the practice obviously was dog care. And very quickly, I really made friends with many of my clients, and it was really fun because it was a small town. One day, I had Skokie coming to my practice, a golden retriever. He was 2 years old, lovely, lovely dog. And his guardian was Monica. She was amazing as well, caring dog lover. Unfortunately, Skokie had major ear problems. And initially, we started kind of doing the regular antibiotics, ear cleaning, and special diets, and nothing really changed. And because Whistler is a ski resort, whenever I had a major challenge, I went skiing. And sometimes I went skiing with friends. And this time I went skiing with my friend Terry, and we were talking about Skokie. And she suggested, why don't you just switch Skokie to raw diet and maybe make a few other adjustments. And I was terrified because at that point I was actually selling kibble. So I didn't know any better. And I was taught that kibble is the best. But then I remembered that when I was growing up, our dachshund Gerda was eating raw food. So I approached Monica with this idea, and we switched Skokie to raw food. And a month later, Skokie's ears were 50% better. 2 months later, his ears were 100% better. And it was really mind-blowing. Since then, I learned that not all ear conditions are as easy to treat as Skokie's were. And we actually saved Skokie from a very invasive surgery because the surgeon that we consulted suggested that his ear canal should be removed. And I really didn't want to do that. Removing ear canals in a dog would be like removing our ear canals. Imagine that someone basically just comes and says, oh, you have ear problems. Why don't we just remove your ears? It, to me, is not medicine. It's torture. And I've seen many dogs that had actually their ears removed in practice by other people. I've never suggested that surgery. So, the first thing that I'd like to talk to you is about the structure of the ear canal and the anatomy, because many people don't actually know that the ear canal is actually L-shaped, that it doesn't go straight down. And there is a barrier, which is the tympanic membrane or eardrum. And if you shove a Q-tip down there or some sort of foreign sharp object, that it can actually puncture the eardrum. But the eardrum also can be punctured by or perforated by an infection or excessive cleaning. All those can be actually causes of injury to the ear. But the ear canal is another kind of interesting, the ear canal has another interesting function. I see dogs' ears almost like a signal light that there is something wrong with your dog's body. It is like the oil light on your dashboard, on your car's dashboard. And when it turns red, and if you kind of looked at it and saw it red, you probably will not run and clean your car or remove the bulb. You will actually inquire what's going on with the car, or with the oil, whether it's leaking or whether it's low, whatever it is. I find that ears are very similar to the nose in humans. Dogs evolved a little differently. Nose is very important. So if they had nasal congestion like we do, they would not really be able to hunt and survive. So they developed in such a way that their congestion happens actually in the ears, not in the nose. And that's a big difference. When I had hay fever as a teenager, I had congested nose and I couldn't breathe through my nose. Dogs have nose that does not do that, but they have ears that do exactly or a very similar thing. They swell up, they get red, inflamed, they discharge and all that. So I think this is an evolutionary reason. There is an evolutionary reason why this happened. And, there are many, most of the veterinary treatments, as I said, are ear cleaning, antibiotics, steroids, special diets, because ear conditions are considered often to be of allergic origin. Unfortunately, most of these conditions do not respond to this treatment, or if they do, it's only temporary. I've seen so many dogs coming to me after years of chronic conditions, after years of antibiotics and steroids and painful procedures and cleaning. The level of suffering that I've seen of our ears is probably one of the greatest degree of suffering that I've seen in dogs, because some of them are really in pain. I would like to share with you another story or case study. I'm no longer seeing patients in practice. After 30 years, I decided that I would like to actually pass on the knowledge and teach the dog lovers you, because I know that you can be empowered and make the right decisions for your dog. To be honest, it is actually much easier to pass this information on to you than some of my colleagues, because I think that we vets have been chosen very carefully for vet schools, because it's very demanding and you have to sit on your ass and study and also follow the principles of certain treatment protocols. However, I think that most of us have been rather inflexible to kind of have our mind open to new and different approaches. Sometimes it is frustrating. Sometimes I have to remind myself that I have to stay open to other techniques and approaches, because the same thing can happen to me. But Coco's story was another kind of milestone in treating ear problems, because it was such a difficult situation. Coco was on steroid and antibiotics for 6 years. This is what his neck looked like, and on the right side you see the picture of his ears. the agony, the pain, the stress, the worry that he and his family went through was unbelievable. So when they got to my practice, I could see that they're at the end of the rope. And I also could see and know from my previous experience that this is going to be a very, very difficult journey, because it's not just about the ears and the systemic disease that the ears express. It's also about the fears that the family had about Coco. I'd like to just kind of give you a summary of what was happening with Coco. Coco was on steroids, on hypoallergenic processed food, on antibiotics, weekly bathing, daily ear cleaning, and daily neck and feet washing. Now, can you imagine like having liquid poured in your ears for 6 years every day? And can you even imagine that someone would suggest something like that? It is like the red light in your car being off or going off and saying your oil is leaking, and you'll be polishing and trying to clean up the red light, or you'll be replacing the bulbs and saying, you know, something is still not working. If we do this for 6 years, obviously something is not working. And I think everyone should recognize it. And if you have a dog that has been suffering for months and years, you cannot let it happen. You have to find some other solution. Now, I can't really talk about all the different little tiny details of ear treatment. However, I'll try to give you a little summary or a little overview so you can actually use it in addressing your dog's condition. As I said, the family of Coco was, number one, very caring, but also very worried. But every family member had very different concerns. And I'm quite certain that if I got a chance to speak to you as a group, that you would have different ways of seeing your conditions. The daughter in the family worried, not Coco's daughter, but the family daughter, worried about Coco's age and pain. The mother worried about the infection spreading in the system. By the way, that very rarely happens, if ever, from the ears to the rest of the body. That does not happen. Pain happens, of course. The father was concerned about his balanced diet and also redness and itch. When I talk to my clients and they have a certain concern, I know that they probably is their own personal experience. So they're seeing the situation through their own lens. So that was the situation. But then we needed to ask why. Why is this happening? Why is Coco having years of problems? We also knew, and I know from my practical experience, that local treatment very rarely works long run. It may work once or twice, but then it starts recurring, and then it starts causing more and more problems. I talked about the red light on your car's dashboard, and I want you to remember it when you are dealing with your dog's conditions or ear condition. Because the ears are the signal light. The ears are the signal that there is something else going on with the body. Now, steroids and corticosteroids. I'd like to talk about some of the Western treatments that are used commonly in dogs. I was actually thinking whether I should use this picture or not. Then I decided to, but obviously covered the man's face. I found it in stock photography, this photo, so it's not like, it's, I can't use it. I can, but still, I felt I should cover his face. When you use corticosteroids, what they do, they actually give you an illusion that the problem is gone. They suppress inflammation. And inflammation is, again, a signal that there is something else, something wrong with the body. Inflammatory response can be also healing to a certain degree, but it doesn't last very long. And steroids put the immune system to sleep. They also put the immune system to sleep to be protected against bacteria. So, when we have an infection and we actually put the immune system asleep, it's like our house catching on fire and we taking sleeping pills as opposed to calling 911. It does give you an illusion that the problem is gone. I one time had a client who came to my practice. She was looking for another clinic and somehow ended up in our clinic because we were quite close to each other. She was not looking for holistic advice, but I convinced her to go through the treatment. And because her dog had months of ear problems, I told her that it would take some time before the problem is gone. So after 2 weeks, I get a call from another clinic to transfer her records because she didn't think that the problem was resolved fast enough. And then a couple of months later, she wrote a complaint to my college because she actually said that I took advantage of her and didn't use the miraculous steroids that the other vet used because the problem resolved immediately. And I actually had to go and defend myself in front of the college to tell them and explain why I don't use corticosteroids in ear treatment and why it's a short-sighted idea. And I wasn't at fault and they were fine with my justification. But this is how complicated ear problems are, that people lose their patience and they actually suspect that their vet is trying to take them to cleaners as opposed to understanding that this is not gonna be an easy ride, especially if it's chronic. I usually say that when your dog has a condition for 6 months, a chronic condition, that it may take 6 months to actually treat, and sometimes even longer if steroids are used. Because the steroid treatments reduce the inflammation, but they also affect the ability of the immune system to respond. So remember that using corticosteroids, unfortunately, most of the creams and ointments for ears have them. Using corticosteroids is like taking sleeping pills. There is a law that is called Herring's Law of Cure. This principle of Herring's Law of Cure is from homeopathy. I practiced and taught homeopathy for many years, and I still use it, even though I think it's just so different that many people are having a hard time to understand it. So I try not to flash it too much, even though I respect it very much. Herring's Law of Cure says that if there is a deep chronic disease, in order to cure it, the body may need to go through some cleansing like diarrhea or vomiting or skin rashes or something that is happening on the surface. In my perspective, and from Mr. Herring's perspective, it's better to have a few rashes and pimples than diseased liver or intestinal tract or heart. So everything that is central and is out of balance cures through cleansing and readjusting, and the body's cleansing responses are diarrhea, vomiting, sometimes rashes, eruptions, and all that. Teenagers, when they eat poorly, they get acne, they get skin rashes, or even if they eat well, sometimes they have a genetic tendency to that. They very rarely end up with some sort of deep chronic systemic disease. So remember this, remember Law of Cure, because it is super important in treatment of ears and what may happen to your dog. Part of the Western treatment is special diets. I always have kind of a, I'm bewildered by some of the recipes, by scientific diets that are formulated by scientists. And this is one of the recipes for a formula for hypoallergenic diet, because quite often ear problems are perceived as allergic issues. Cornstarch, hydrolyzed chicken liver, powdered cellulose, or basically shredded up trees and cellulose, are the first three ingredients of hypoallergenic diet. Now, I've never seen dogs thriving well on chopped wood and wood shavings, nor on cornstarch and hydrolyzed chicken liver, knowing that chicken liver can be actually overdosed quite easily. And as a second ingredient, I so would love to have a conversation with these nutritionists. I so would love to have a friendly, amicable, but very open conversation, because in my mind, this is nothing else than big, big BS. And I still don't know why it's happening. And I still don't know why people who are actually giving these diets to their dogs are not reading the label and not using their common sense, because I'm sure that most of them are smart enough to see what's going on. I would like to talk to you about what I think is going on with ears and what I've seen working really well. So beside the local kind of issue of ears being inflamed and painful, we now know that the ears are an expression of something else going on with the body, in the body. And there are three main areas that I notice actually relate to ear problems very much. One of them is the cervical spine, and especially the first cervical vertebra and misalignment and tightness. Then there is the area around the T10 or thoracic 10 vertebra that is related to the liver. And then it's the lumbar area that is very closely connected to the small and large intestine. So when you look at it, neck, liver, intestinal tract, there is a lot that can go on. I personally have experienced the relationship of my nasal congestion and diet by knowing that if I misbehaved with my diet as a teenager, I was congested. And I also treated my allergies by eliminating dairy and grain or wheat at that time. Ear problems are dietary. So it can be loosely stated that they are actually kind of diet hypersensitivity or allergies to a point. But how about species inappropriate diet, a diet that does not actually belong to dogs' bowl? That's a problem. Liver, our liver is overwhelmed, dog's liver is overwhelmed. We live in a toxic environment. And also when you look at how polluted our food and food sources are and the air and water, it can get overwhelmed. But mainly, I think that kibble and processed food is to be blamed for that issue as well. So let's look at some of these areas and let's acknowledge for a moment that the ears need to be treated locally, but also systemically. I know that most of you will wonder what to do about cleaning. And I will have a few little bits and pieces in this presentation about ear cleaning. The first thing that I would like to talk to you about when to clean, because most people don't really understand that wax builds up back if you clean it out, if there is a problem. I call dog ears, or I don't call them, but I compare them to flushing toilet. You flush the ears, you clean it, they're clean, and 2 days later you have the same amount of wax, and you do it over and over and over until you introduce some sort of pathogenic bacteria and resistant bacteria because you overclean the ear and you disturb the bacterial flora. When you flush the toilet, the water fills up back where it was before. And that's what I noticed. I could flush sick ears or ears that are not well forever, and wax would build up. So I actually decided that when I have, the step that I took was when I had ears that were chronic, I would not clean them excessively. I would not clean them repeatedly. I would clean them maybe once a month, and I would instruct my clients not to clean them at home, even if they had wax. If your dog's condition is chronic, cleaning it out will actually increase the likelihood of you introducing pathogenic bacteria. The indicator for you, whether you should do something about your dog's ears while you're actually addressing all the other things, is whether your dog is comfortable or not. And even if he scratches here and there, it may be better to leave them alone. Leave wax. Systemic treatment will help, but do not overclean your dog's ears. This is super important. And I know that textbooks say, you know, whenever you have otitis externa, which is a fancy name for ear infection or inflammation, in fact, you have to clean the ears on a repeated basis. But I have seen that not working. That's why I'm suggesting minimal cleaning. I have a home recipe for ear cleanser, even though, as I said, don't use it too often. I don't have a special ear cleaning solution on the website because I hesitate to encourage people to clean ears too often. And I also hesitate that people will think that ear cleaning solution is supposed to cure a dog's problem. I have not introduced ear cleaning solution because I don't want to get negative reviews. I don't think that ear cleaning solution actually on its own will work. And negative reviews means that we have less of an opportunity to share information that is useful with other dog lovers. It's about trust. It's about reputation, and I don't take it lightly. But this is a home recipe cleanser that you can actually put together. You can use skin spray. I am sure that Alicia or Christina, who is helping us in the background. I'm sorry, Alicia, I didn't introduce you today. Alicia is one of our regulars at the Facebook Lives, and Christina is in the background, not on the screen. Hi, Christina. Anyway, so this is, you can take a screenshot, and if you don't have a screenshot, I'm sure that Alicia will post this little recipe on in the comments. It is super tempting to clean ears, especially for those of us who are obsessive compulsive. I don't know whether I'm obsessive compulsive. I know that I don't have an obsession to clean ears, but some of you may. It's like washing hands or thinking that, you know, if you don't see the wax, that the problem will disappear. I would like to show you some different pictures of ear condition and just comment on them, because there's a difference between an ear condition and an ear condition. On the left side, you can see a little bit of wax, and I would probably just wipe it off, or, you know, on the surface, and I would not be pouring any solutions in until I see what is left after I implement the whole holistic treatment that I will talk about. On the right side, there is a bad news. Infection, very painful ear, a lot of discharge. This ear was smelly and pretty disgusting and causing a lot of discomfort to the dog. This ear has to be treated under anesthesia. We have to do a whole bunch of, we have to take a whole bunch of steps in the veterinary clinic, like culture and ear cleaning and all that. And very possibly even antibiotics, but I'll talk about antibiotics later and when to use them and not. So I know that sometimes it's confusing, and examples are the best to kind of clarify. I'm just going to go from left to right. The ear up at the left, I suspect that it has been cleaned more often. Just I kind of recognize it, and I wouldn't probably see a vet for this. I would just make sure that your dog doesn't scratch this ear. The second ear on the left, from the left, that may need more careful assessment, possibly anesthesia and cleaning under anesthesia. The third ear, again, it definitely does not look happy. If I can compare this ear to nose, it would be congested nose for sure. But again, you can give it a little bit of time, especially if your dog is comfortable. I would not do excessive cleaning. Again, maybe an overcleaned ear. The same thing applies to the fourth one, but not as clear. The one on the very left bottom is most like an infected ear. The second bottom is an ear that I would clean possibly without anesthesia, but definitely in the veterinary clinic and under supervision, and it requires deep cleaning once. And then maybe for the second time in 2 to 4 weeks, depending how things would be going. The middle ear at the bottom is quite chronically affected. The fourth ear, I would say I would have to examine it more deeply to know and understand. The last ear at the bottom on the right, again, I would probably just take a very gradual approach and be patient with it without any major cleaning or intervention, unless the dog is uncomfortable. I could go through second sets of slides. You can see that there are so many different variations on the theme. I'm just going to show you this one, the third top. It looks like this dog's ear canal was removed, which breaks my heart. And then I'm just going to talk to you about or show you this one at the bottom left, very chronic ear, most likely with pathogenic resistant bacteria, a lot of issues with the digestive tract, probably liver, a lot of mismanagement. So it's not easy to talk about all these conditions, all these different examples, because my ears hurt just thinking about it. And that's why I'm sitting here. And that's why I'm hoping that you'll share this webinar if you're watching it recorded, and that you'll tell people about what can be done. So as I said, there's some situations when you definitely need to go and see your vet immediately. But there is also a possibility that your vet will not be as open-minded, with all the respect to my colleagues, and will not agree not cleaning the ears and not to do liver cleanse and not to do other things that I'm just going to talk to you about. Sometimes it's good and useful to know what bacteria is growing in the ear. So ear culture is not a waste of money. It can actually be a real life-saving and ear-saving situation. Not life-saving, but maybe, but ear-saving for sure. What I would like to talk to you now about is healing cycle. And healing cycle is a very simple way, at least from my point of view, simple way of addressing almost any health condition, or at least starting the treatment of any health condition. It's like a universal body language where you need to detox the body and get rid of toxins, because the toxins are like rowdy visitors that disturb the metabolic functions and immune functions of the body. They also take place of the healthy minerals and nutrients, meaning that if toxins are there, they can cause serious problems, disturbances. Then obviously we need to nourish our body. I was actually planning to find some sort of wilted bush of tomatoes and then tomatoes that are healthy and thriving. Everyone understands that fertilizers, healthy natural fertilizers, ideally organic, are needed for tomatoes to grow, and that the soil is depleted and it's not always full of nutrients as we think. And we often forget that food and the essential nutrients are actually essential for not only life, but well-being. There's 37,000 billion chemical reactions happening in the body every second. It's 37 with 21 zeros. And those reactions will not all happen if there are deficiencies. And the last little bit of the healing cycle is alignment, spine alignment, neck alignment. We'll talk about that too. I am thinking about adding a fourth step, and that's DNA repair and mitochondrial boosting and all that. But we'll talk about it maybe another time. So applying healing cycle is very easy. And this is what I'm going to talk about now in the last portion of Facebook Live, of this Facebook Live. I also have some links here. So the first detox, you know, some people, I know some people who basically talk a lot about problems that we have, but they may not always offer a solution. When I was in practice, I was using solutions of some other companies and people. But then I wasn't always happy with the results. So over time, it became very logical for me to start formulating my own formulas. And luckily, they're highly rated and regarded. I'm very grateful about it. It's very humbling to see that people like what you do. But what I want to point out is that if I don't offer solutions that I think are, from my perspective, the best, or that I would use for my own dog, then I'm doing only half of a job. I could bitch and complain about how poorly ears are treated, but if I don't offer a solution, then I wouldn't do a really good job. There's enough complainers without them coming up with a solution anyway. So this is my way of treating ears, and I would like to introduce you to Livertune. Livertune is actually our newest product. I'm going to start sharing again. I think that I'm not sharing the whole screen, so I will just do it this way. It is a product that is made of different herbs that are actually focused on liver health. You can look at the ingredients. Ingredients are right down here. And you can see that they are nicely described, from artichoke to dandelion to mill thistle, barley grass, turmeric, broccoli sprout, cilantro, ashwagandha. You can learn about the product more if you go to that link. And that's the first step. So that's the detox that I do. I usually do detox as a preventive measure once every 6 months. I do it for myself, packs, and it may, you may find it funny that I use dog products, but they're human grade. Livertune is certified organic, and I know where they're sourced, and I know that I can trust them. So that's what I do. Going back to the healing cycle, I will show you the next step. I'm just looking for my slides here. Somehow I lost the slides. The next step is nourishment. And nourishing does not mean going to a store or your vet and getting kibble, because nature never intended our dogs eating processed food. Again, my tool and my approach is to offer you a recipe maker. Recipe maker is a result of so many people asking us for recipes. And I kept saying, I don't want to be a recipe writer. I want to do medicine, and I want to learn new things, and I want to help in a different way, but I just don't like recipes. Mainly because even when I cook, I very rarely follow recipes. But this recipe maker is available because what we did, it's a universal tool for recipes. And I will again show you the website. I have to switch here a little bit. So my apology. Actually, I'm just going to do it this way. Oops. Okay. So Recipe Maker is a tool where you can basically, I have a screen here, create your own recipes depending on what ingredients your dog likes, what ingredients you have at home. It's made of meat, vegetables, and bones. I prefer feeding veggies. I know some of you do not. I've seen dogs that actually eat meat only. Their body and their system seems to be a little overwhelmed, and I have ways of kind of checking the different areas of the body and the organs by hand and feeling the energy. When it comes to ears, see what fits your dog. Sometimes it may happen that if you feed, let's say, beef or chicken, that your dog's ears get flared up. So you will have to figure out yourself when it flares up and when it doesn't. But this recipe maker actually spits out a whole recipe for you, including doses of supplements and essentials and all that. So it's really easy way of you creating recipes. And if you're creative, you can also send us some recipes when you make them and send us a picture, and we'll be very grateful for your chef abilities. Anyway, the next thing that I'd like to talk about is essentials. There are essential nutrients that I find are really helpful in balancing the body, balancing the system. We call them endearingly fabulous four. One of our community members actually started with that. She says, these four products are fabulous. And and I don't always take compliments very well, but I do have to say that I do take them with the exception of the probiotics, Gutsense, because it's formulated specifically for dogs. The other ones are labeled for dogs, but we will be coming with a human formula as well, capsulated formula. Minerals, vitamins, probiotics, and omega oils are important essentials. The body cannot make them itself. The probiotics, when your dog drinks from puddles and drinks chlorinated water and all that, it sometimes is important, or it is important to supplement probiotics. And that's what I do with packs as well. Feel Good Omega, super important for cell regeneration, anti-inflammatory effect. We have chosen calamari or squid-based one that is toxin-free and tested mercury and toxin-free. But this is the nourished phase. So we talked about detox, and then we talked about nourishment. Okay. The next phase is alignment, and I'd like to stay with that phase. I would like to start with this little quote that I found. It says, God loved dogs and gave them forests and meadows to run on. Humans love dogs and give them choke chains and shock collars. I'm so thrilled that collars, choke chains, shock collars are much less common than they used to be. Just on the weekend, just past weekend, we were coming back from Vancouver Island and we were waiting for the ferry that was delayed, as usual. And there were 5 dogs, 4 of them had a harness. And the reason why this is so important to use a harness instead of a collar is that the neck is a governing area of the body, and it has a very close relationship to your dog's ears. There are other activities or problems that may affect the ears, but the collars are actually very common. Also, some dogs with ear problems may be hypothyroid, may have low thyroid hormone. And it often happens because the thyroid gland is right in front of the throat here. And if a dog pulls, the thyroid gland gets traumatized and as a result, inflamed. And the immune system actually removes the cells of the thyroid gland, and that results in hypothyroidism. This is not commonly discussed in veterinary practices or even textbooks. But I'm quite certain that this is correct because I've seen large dogs that pull on the leash, on the collar, actually being more likely hypothyroid. It's just kind of a common sense thing. We don't put collars on babies. And I know that some of you may still be convinced that collars are okay. I have a lot of empathy with you because we've been around collars for so long that it's hard to think or kind of like believe that that collars would be wrong. But I love people who say sometimes 90 people are wrong and 2 may be correct. Maybe sometimes 999 people are wrong and 1 may be correct. And it's not about being wrong or right. It's about really kind of using common sense. So what we've been using, and this took us a little while to sort out as well, we've been using a front clip harness that also has a clip on the back that you can see actually frees the collar or neck of your dog, not collar. I use the collar only for ID, for Pax when he is off leash, to actually make sure that he has something on if he got lost. Another issue, another problem is our leashes. You know, the flexi leashes that so many people use are a big challenge, a big problem, because they have a spring and the spring applies constant tension on the collar or on the harness. Not ideal at all. Also, when you use the brake, sudden shocks can actually cause neck misalignment. It's not that gentle, especially when your dog runs and wants to see something or sees a squirrel and suddenly he runs at the end of the leash. a big problem. But once again, I always worry that you would take this as a criticism of what you do. Please don't, because I understand that you love your dog and you do your best. It's more about not knowing what we don't know. I'm sure that there are many things that I don't know what I don't know. So ideally, use leash that is gentler. We have actually on our website, we have one that is handmade from natural materials. It's shock absorbing. And if you attach it to the harness, perfect, especially if your dog has ear problems. There are other activities such as tug of war or carrying sticks excessively, or even excessive chewing when your dog chews constantly. The temporomandibular joint is also very closely related to your dog's ears. And tension, energy flow congestion in that area can affect the ears. And sometimes dogs scratch because they have tight chewing muscles, masticatory muscles, and people think that they have itchy ears, and they're actually trying to massage the muscles. And that's actually something that often is missed. Alignment by my friend Dr. Lana Patterson is what I practice very often. I drive for about an hour to see Dr. Lana. This is Sky, our previous dog. He was about 15 years old here. I think it was his birthday, and Auntie Lana gave him a gift. Chiropractics, physiotherapy, acupuncture, all those are alignment techniques that he can use. I don't have much time to talk about them in detail, but if you have any questions, you can definitely ask. Additional steps, I'm just going to go really quickly about this. There are homeopathic remedies that you can use to neutralize potential vaccine side effects that sometimes can be part of the problem when it comes to ears. There's mercury in vaccines as well. There is a homeopathic pharmacy, and I'm going to show you that link again, that you can order the remedies at, and make sure that you take a screenshot of this. Helios is in the UK, but you can actually get the homeopathic remedies from Helios. This is the homeopathic pharmacy here. Going back. Oh, maybe actually wasn't sharing. Alicia, was it sharing? It probably wasn't, right? Was it sharing? Okay, great. So what do we need to focus on when we're treating ears? We need to focus on the liver and cleanse the liver. We need to focus on the digestive tract. We need to focus on making sure that we supplement our dog's diet with essential nutrients. I forgot to tell you one thing, that if your dog actually is a bull retriever or loves to sprint and run, or just injured lumbar spine, that can affect the digestive tract, but somehow mysteriously it also affects the ears. Neck and back, super important. And sometimes there may be hormonal disease. So if you apply everything and you do everything right and your dog is not getting better, there may be Cushing's disease or other problems, hypothyroidism. If there's one-sided ear issue, it usually means that I actually seen one-sided ear issues when there was one-sided lumbar spine injury, or there can be one-sided neck injury, or your dog walks on one side on the leash and it pulls to one side, right? It's really interesting to see all these different correlations. It's so cool, so fascinating. Post-steroid aggravation, once you put your dog on repeated doses of steroid medication, whether it's systemic pills or just drops, it doubles or triples or quadruples the length of treatment. When I see corticosteroids in medical file, in medical history of a patient with ear problems, I dread it, because I know that I will need so much more patience with my clients, and they will need patience, and that there is a high chance that I will actually lose them in the process because it will take quite a long time. But there is no other way. It's almost like wanting to climb a mountain in an hour when it really takes 5 hours. There is no shortcut other than more steroids and actually affecting your dog's general health. Remember the lady who went to the other practice and was so impressed that steroids were prescribed and the condition actually was, better. I unfortunately don't know what happened with her dog, but I know in general that dogs like this are actually usually systemically ill very fast and shortens their lifespan. Remember Hering's law of cure. It takes some time, and sometimes it can get, a little messy, and you will have to have guidance of an experienced practitioner, a veterinarian who's open. If your dog is scratching ears, sometimes it may mean that you may need to put a little inflatable donut on his or her neck. Antibiotics, sometimes they may be necessary when there's a resistant bacteria. If you see that your vet took a culture and you get results and there is a resistant bacteria, that usually happens when the ears are overcleaned. And when you clean the ears, the weak, helpful bacteria will die, and the strong resistant bacteria will thrive. It's like clear cutting a forest. The invasive species are more likely to establish there. So, treating ears is a real roller coaster. When I was kind of preparing this lecture, I was thinking maybe we should just kind of establish some sort of ear treatment support group. And then I thought maybe it's a crazy idea. But if you have any questions, you can always email us. Aim for comfort. Do not aim for perfect ears, because it really is different with every dog. It requires patience. And sometimes, depending on your dog's breed, if I have a spaniel and he has wax and a little bit of inflammation in the ears, I know that there's genetic predisposition and that we will have to settle for good enough. But if your dog is comfortable, that's what I'd like to aim for. So be brave. Don't hesitate to ask us questions. And don't be afraid to be different. Because if something is used, it doesn't necessarily mean that it's actually the right choice. And that's what I've learned about ears the hard way, because I struggled with them for years when it comes to my practice and my patients. But then I dare to be different. There's a point in veterinary practice where you just don't really care about what other people think. And that's where I am. I really do not care whether someone will judge me for my opinions and sometimes my simplified approach to medicine. I think that simple is good. And I think that empowering you dog lovers is also super important. And I hope this has been useful and that you will ask questions. So we have a few minutes for questions, let's say 10 minutes, and then we'll go from there.
Excellent. Thank you so much. We definitely have some questions, so I'll try to be as succinct as possible. One of the first questions is there any way to treat an oral hematoma naturally?
Oh, I see. I didn't talk about oral hematoma. For everyone else, it's basically a condition where blood blister, huge blood blister happens in between the layers of the ear. So it looks like the ear looks like an inflated balloon. My experience is that it can be partially traumatic, but it's also kind of an immune system reaction, maybe toxic reaction. I would start with sometimes it is necessary to actually drain this blood blister. Sometimes it absorbs, and I would recommend you talking to your veterinarian. If it does come back, you just basically apply what I just suggested, and things should get much better. I dare to say that it's a combination of systemic disease, dietary issues, maybe deficiencies, immune system agitation. That's kind of the simplified summary of what I think is going on. But you will have to apply the healing cycle, and when you do, most likely things will become better. But initially, it may be surgical condition. Sometimes dogs are lucky and it absorbs, but most likely it doesn't, or it won't.
Thank you. The next question is from Julie. Julie has a question about plucking the ear hair. She has 2 mini poodles. One of them in particular does not like it if she touches his ears. So he has a lot of hair in the ear. She does trim it short. Is that enough? And thank you, and a big hug to Pax, she says.
Pax was chewing a bone, so he's now sleeping probably. I gave him a bone before the live. Thank you for the greetings. I wanted to talk about hair plucking because ear hair is actually a result of breeding and not really considering our dogs as much as the looks. And, you know, humans are funny. We breed for looks, sometimes function, but often for looks, and forget that functionality is important. So you won't be able to get rid of the ear hair other than plucking. But I usually say that it's not necessary to pluck ear hair unless your dog has moisture in the ear or is aggravated, itchy. I have a friend whose dog had ingrown hair, or almost like really thickened, like malformed hair pieces in the ear canal, and it really bothered her. And in that way, you know, she had to be put under anesthesia a few times a year to actually pluck it out. If your dog doesn't bother the ears, I wouldn't pluck it. If your dog bothers the ear, try to pluck it, but not too often, because the trauma also results in inflammation and sometimes in additional bacterial growth. Ideal, not plucking, not doing anything. Second choice, plucking. And third choice, I don't think there's any third choice.
So in Julie's case, she says that she can trim it a little bit. If she can't pluck it, is the trimming like good enough, or should she take it to see a vet technician for some plucking?
I got it. I didn't answer that part of the question. It's actually okay to trim it if your dog's ears are fine. And especially if your dog doesn't like the plucking, and otherwise there's no problem. Absolutely.
Great, thank you. The next question has come up several times from the community to do with packs. And do you put cotton wool in his ears when he flies or when he swims? And if so, why or why not?
You guys have asked such good questions today, always, but today, especially today. I forgot to say that ears are self-cleaning, that you don't need to clean your dog's ears if there's no problem. I cleaned Sky's ears, our previous dog's ears, maybe twice in his lifetime. They were absolutely spotless. Definitely don't put any Q-tips or cotton swabs or anything in the ear. There's a barrier. It's not like there's an opening hole to the middle and inner ear. The eardrum is a barrier, and it should serve well when your dog swims. Don't pack anything in. Don't pour anything in if you don't have to, if your vet doesn't instruct you, but definitely no daily cleaning or weekly cleaning or regular cleaning, to say. I don't put anything in his ears when he swims, when he goes crazy in the ocean. Absolutely not. And yeah, nature is really amazing. The design, the natural design is great, and you don't need to worry. Just check your dog's ears once in a while, or if he bothers them or she.
Thank you. And the next question is to do with hearing. Senior dogs can lose their hearing just like humans. Is there anything we can do to avoid this or minimize it outside of not exposing the dog to loud noise and keeping the ears healthy?
You know, this is such a close to heart question, because Sky, when he was older, lost his hearing, or he was losing his hearing very gradually. I used something that actually improved his hearing, but I wasn't sure whether it was good for his general health overall. I used a machine that is called Beamer, and it improves the blood circulation to different areas of the body, and I could see that his hearing actually improved. Hearing loss in older dogs is very complicated. Personally, I wouldn't recommend Beamer on an ongoing basis, because we still don't know what the overall side effects and effects are. I wanted to try it, and I think that it yielded results, but I don't think that I can responsibly recommend it. You know, working with your dog's chiropractor or physiotherapist, making sure the neck is aligned, massaging around the ears and then the head, taking all the precautions that I mentioned here. But even then, aging and loss of function is part of life. You know, I need glasses here because I'm well over 50 now, and I need glasses, and I wish I didn't need to use them, but I do. So hearing loss is very similar, and dogs usually around 12, 13 years, start losing their hearing. That's usually the time. And sometimes dogs lose balance. They have vestibular syndrome, which is a loss of balance, and it does freak dog guardians out when it happens because it looks like a stroke. Most often it does recover, or dogs do recover, but it is a distressing condition, and it takes a few weeks or sometimes months to recover. And we have an article on that too. Anything else, Alicia? One more question.
There are, let's see. Well, there's two things. One, Hypatia actually asked about vestibular syndrome. So thank you for tying that in. And we'll be sure to post a link to the article that addresses that. The other question, if I can pose, is from Janice. She said she can't see anything inside of her dog's ears, but he will swing his head hard at times. And there also seems to be a sticky or mucousy sound, but she can't see anything unusual in the mouth. He's a 5-pound Yorkie. Any ideas are appreciated.
When there is a squishy sound, liquid sound, I would definitely go in and have your veterinarian check the ears and make sure that he uses an otoscope, basically the tool that you look down the ears and the ear canal. I very much recommend checking the neck, making sure that it's not out of alignment. Dogs sometimes shake their head when they feel uncomfortable. If so many dogs have collar injuries, I would say, sadly, 8 to 9 out of 10 dogs would have collar injuries. The ones who wear collars, and the ones who don't wear collars may have neck injuries from twisting and falling and tug of war and carrying heavy logs and different things. So I definitely would check that. Applying this protocol that I just presented is the best way to go.
Excellent. And when it comes to the home recipe cleaner that was featured in the slideshow and that we have posted in the comments, how often should people use this, i.e. on a regular basis every few months if the ears are healthy, or is it only to be used if there's an issue in the ear? And if so, daily, weekly, what does that look like?
Ideally, do not clean your dog's ears. If you see that there is a problem, there is a wax excess and your dog is comfortable, I would still address all the other issues. I would also look at what is good enough, meaning that if there is a little bit of wax, it's the same as if some people sweat more than others. I would not really be addressing that. But if there is a point where there's a degree of discharge, I'm just going to try to show you that picture again. Just a second. I will need to look for it. Okay, this is a good example. This is the kind of ear that I would probably use the solution for. I would clean it maybe once every 2 to 4 weeks. Just on the surface. If you see that there's something inside and your dog is still bugging the ears, just go and see your vet. Don't really try to flush and clean the ears on your own. Sometimes the eardrum can be perforated. There can be a foreign body or ingrown hair or something else. It's super important to keep that in mind. And that's about it. I think that we are done with our ear session. Thank you so much, everyone. If you have any questions, you can always ask them here, and don't forget to subscribe to our newsletter because we post helpful healing tips every week. And our website is peterdobias.com, and the subscription button is somewhere there. Thank you so much, and give your dog a hug for me. Bye-bye.